I'm currently working as a senior resident in the Department of Pediatrics at JNMC College, which is in Wardha, Maharashtra. Baby Chakra app is a very unique app which helps the parents in all their queries and doubts regarding the minute things of parenting, which is a vast spectrum. So you can download the app and use my referral code, which is my name, Maithili, in capitals. So I'll be discussing about COVID-19 in children along with feeding, which is a very vastly and it's a very commonly discussed topic in the current scenario where parents are extremely worried about nutrition. Uh, I have an Instagram page as well, which I've not started it that well as of now, but I'll be sharing different tips and various current related events which are happening and which is relevant for the parents as well. So currently, in the pandemic which started in 2020, it's been more than 1.5 years. We'll be completing 2 years. Hopefully, not there is a third wave or not. So the first wave did not involve the kids that much, but coming in 2021, we had a very dreaded second wave in which a lot of young lives were lost. So kids still there is not a very high mortality rate, but if you compare with the statistics as compared to last year, uh, severe forms of infection have been seen in children this time, where if around 100 children are infected with COVID, around one or two will have a very severe type of infection, also known as MISC, which is a very dreaded complication, which has a very higher mortality rate if treatment is not started on time. So, mostly children who are infected with COVID-19, they are usually asymptomatic and they generally do not have a very uh, bad spectrum of the disease as compared to different other bacterial infections. If it is recognized early, even the mild ones do not progress to the moderate forms, and the infection is usually latent and is not that life threatening. So we did not have a very severe spectrum in the first wave, but in the second wave, some cases of MISC were also seen. And if treatment is not initiated at the right time, the rate of mortality is high in children, where severe infection is rare, but if it happens, it needs to be treated very cautiously and meticulously in an ICU setup. Also, when the pandemic started, the schools have been shut, so the children are mostly restricted inside, where all their schools are taking place on their laptops and their phones. So and since they are stuck up in the house, they are playing schedules, and what the kind of food they eat, that has also changed a lot. And when they were going to school, all their routine was set. They used to take a stipulated tiffin to their schools, where their mothers would give them a fixed meal in the tiffin. But with COVID-19, the schedules have been disrupted, and it has now, after 1 year, children are a little settled for attending school on their laptop. So now, since they have adjusted themselves, now it is a little better. But when the online schools had just started, it was very new for them. So their overall health had also taken a very bad turn, because they used to be stuck up on the screen only for a very long time, and they used to not play. And they had easy access to junk food as well, since they were at home only. One question has come up that is it safe to keep the children on continuous for 4 to 5 hours? Even for adults also, continuous screen time for more than 20 minutes should not be there. Especially for children, it's like the rule of 20. Continuously 20 minutes you can look at the screen. After that, you need to take a break of at least 20 seconds, and then resume back to the screen, because refractory errors have become so common since COVID has started. Since children are mostly glued to their screens, be it attending school or watching TV, and controlling them has also been very tough. But also, children learn from their parents, so parents should also lower down their screen time, and they should take frequent breaks. Even also, infants should not be exposed to the screen at all. A child less than 1 year should not look at the screen for a, even nowadays when they're eating, when weaning starts, children mostly get used to watching Peppa Pig and any other cartoon while eating, so that is absolutely wrong. A child less than 1 year should not be exposed to the screen at all. For immunity in less than one, your child is 1.5 years old. I got a question from Pooja. Immunity wise, first foremost, your child should be exclusively breastfed for the first 6 months at least. After that, the norms suggest you should not stop breast milk. You can continue as long as you have a good supply, because a child's first vaccine is the breast milk. So make sure that your child is breastfed well. And when you start the complementary feeding, you should not call it weaning. You better call it complementary feeding. You should start it and use only home cooked food, which is easily digestible by the child. You can add ragi, you can add mashed fruits, and avoid giving fruit juices to the child. That may lead to diarrhea and other infections as well. Okay, one question by Prakash. Will it be safe to send our kids to school again, or what should be taken care of? First and foremost, the current guidelines have not yet come for schools, but there were some news stating that the schools might open by September end. But make sure that the school to which your child goes, the staff there is completely vaccinated. They're following all the norms which is required, be it wearing a mask or a face shield. And the staff should be vaccinated, and all the norms should be maintained, like it was before the pandemic, like 50 students per classroom. That has changed now. Number of students in one class should be less, so everything related to social distancing must be followed. uh, Increased hunger pangs in children. One question by Ketki. uh, Children get hungry frequently because their timetable is only so changed as it was before the pandemic. So make sure that they are hydrated well, as it can, mostly thirst can also lead to a false pang. But hydration is also again very important, and mostly small children, like before they begin to speak, they are not able to tell that if they want water or not. So especially junk food and packaged food like chips and biscuits should be kept off. Children should not have access to it. It's better you don't keep such stuff in the house. But also make sure you treat your child from time to time if there are any specific demands. Otherwise, it will become difficult for you to control this in the future. And hydration is again very important overall also, if it prevents infections as well. Okay, Prachi, you're unable to concentrate on your kid as you're a working woman. Should give him for quick snacks. You can make sure he takes at least 1 to 2 servings of fruits per day. And fruits, like any seasonal fruit, you can give, and make sure you give it in the original form and not in the form of a juice or any milkshake, because eating the fruit is better than drinking it. And any quick snack you can give, any homemade snack, you can make him a dosa and add vegetables to everything. So uh, that will be better. Then make sure he eats three main meals, like breakfast, lunch, and dinner. And evening snack is also very important. And make sure that he doesn't go to bed hungry. Make sure the dinner is had at least 2 hours before the child sleeps. Vaccine in India as of now, no. They are not yet started. In the United States, they have already started for children more than 12 years old. Rachna, is it possible that child gets virus of COVID by others? Yes, definitely, it is possible. Uh, Children may get infected, but they may not manifest that severely how adults have. The second wave has been very bad, since a lot of the young people have succumbed, also because they were not vaccinated. So since now the vaccination numbers have drastically improved, the death rate has reduced now. The number of positive cases have also decreased, but children need to be protected. Where infants, it's fine if they don't wear a mask. Like if the child is more than 3 years old, then mask should be worn. And children should be trained early that now social distancing and frequent hand washing is a norm. This is going to remain for a very long time, so we should train them in home as well. The regular chapati, bhaji, dal, rice, and a traditional breakfast is a good option. Definitely, the children should be fed with local foods only, like the the traditional breakfast items like poha, upma, dosa. Any ragi preparation also can be given. And you can give the child even chapati bhaji. It is fine to give it for breakfast as well. Just we need to make sure that the child is not fed with too much fats. And the child should have a moderate playing time and a reasonable amount of physical activity every day. Suman is asking, is it safe to take children out? Well, unless it is, first of all, unless it is not important, avoid stepping out if you can. And you can take the child out. If it's an infant, you need to be a little more careful, because depending on how well is your child vaccinated, how if it is on time, uh, and even you have to go to the doctor. So try to combine the visit, as it should match with the baby's vaccination schedule. And also, to take children out, you have to follow the norms what you are following. Social, where places where social distancing is guaranteed, you can go there. Otherwise, until the time the infection rate has drastically come down, you cannot take your child blindly anywhere. Places where the norms are followed, you can give. Ramesh, you your wife was suffering from COVID. Can she breastfeed the child? Is that safe? What care should we take? Because breast milk is totally safe. There is no problem to breastfeed the child. If and currently your child, your wife had COVID. Now she is COVID free, so she can definitely breastfeed the child. Also, the previous guidelines, they had told that if oxygen support, or she is critical, or she has a high viral load, then direct breastfeeding should be avoided, but expressed milk can be given. You can provide expressed breast milk. And It is a passive transfer of antibodies from the mother to the child. So anyway, the child will be protected from different other infections as well, since he is getting antibodies from the mother. But if there is some issue with the mother's milk supply, so you can opt for any pasteurized human milk donor as well. We have many milk banks in the city and various parts of the country. Is child, Preeti is asking, is child suffering from fever the symptoms of COVID? Doctor? See, COVID-19 is a viral infection. It has a vast spectrum of how it will present. In children, usually it will present with a fever. Uh, it will be fever, nasal congestion will be there. Also, children may have a diarrhea. They can have a sore throat. A child younger than 3 4 years old cannot comment on whether he can smell or not. So that part, in child less than 3 years old, we cannot comment. But a usual presentation of fever, dry cough, diarrhea, this is usually seen. So you should see whether your child was very active before and during the fever, whether he was very dull and not playing that well. So you need to undergo tests then. Kids are getting irritated, what should we do? So yes, since we are also stuck up in the house, so are children. So for them, you should build up an active environment in the house. And firstly, screen time should be restricted. They shouldn't be addicted to playing on the smartphone or watching sports on TV. uh, it is of course very boring to sit in the house and not watch TV or do anything for entertainment. But make sure you talk to your child, involve them in activities like painting, drawing, any other skill they have. If they are interested in dance or singing, nowadays almost all the teachers who teach dance and singing, they have switched to online classes. So you can enroll your child, and make sure the environment in the house is very happy and stress free. But you need to make sure that otherwise children get easily bothered by these things. So the environment in the house should also be very good, so that children are kept safe. And otherwise all their routine activities should be going on. They should be attending school regularly. And if both the parents are busy, if they have work from home, so one parent should at least dedicate a fixed amount of time. Both should take turns. So any takeaway message for working moms? So working moms, given some of the professionals are still working from home only, and they have to be in front of the PC for a very long time. So it is but natural that the kid may feel neglected. And since they are also attending school, so the mother her working hours and take frequent breaks, so as to just check on the child that what is exactly happening with the child. You can if you are lucky enough that you have an elderly person who is in the house who can help you take care of the child, that is also a suitable thing. Or otherwise you can hire a trustworthy helper, like a maid, who can at least help you in easing out all your duties. And of course, if the mother is can't dedicate 24/7, as she is earning for her child's future, it's you cannot expect a working mother to completely cut off from her work and be with the child. So you need to plan out your day very properly, and make sure that you give time to your work as well as to your child. Make sure you have some help at home, and make sure if you're hiring someone, then that person is also has taken 2 doses of the vaccine as well. So hire any helper also very carefully. So you can download the app and use my name as the referral code, where my profile is there on the app, uh, Baby Chakra app. So you can log in, and a lot of information is shared there. And also I have an Instagram page, which is at present not very active, but I'll be posting very important topics, and which can solve the doubts of parents as well. uh, and make sure that you are you are vaccinated, so that you can prevent any severe infection in the house. And make sure that your children also follow all the norms, and just tell them that this is going to be there for a reasonable amount of time. Their frustration we can also understand, but we need to really make them prepared. And if we are anticipating a third wave, we should be more cautious and take care of children, as it is touted that the third wave will mostly attack them, since they are the most vulnerable people at the moment, since as of now in the country. So hope you liked my session. uh, so that's all. Thank you so much. I hope you liked